Welcome back if you are just joining us. This is INX Prime Live. Remember, we are on your screens every single Monday to Friday between the hours of 6 p.m. and 8 p.m. Now, we know that the United Nations investigators have actually accused Israel of deliberately targeting Gaza's health facilities and also killing medical personnel during its war on Gaza. Now, just on Thursday, the United Nations Independent International Commission of Inquiry, led by South African Dr. Pillay, said Israel is actually committing war crimes and is trying to exterminate Gaza's people through its relentless and deliberate attacks on medical personnel as well as facilities. We are going to actually be looking and chatting to healthcare workers for Palestine. Is actually a South African NGO in support of Palestine, and I am joined now by executive member Dr. Firoza Amien. Assalamu alaikum, doctor. Thank you so much for joining us tonight on INX Prime Live.
Wa alaikum salam. Thank you so much for having me here.
No, it's such a pleasure having you. And I want to get straight into this conversation as well. Now, we all watched in horror last year, when the Israeli army actually shelled the Al Ahli hospital. And we know that the Israelis actually denied that, but then proceeded on to shell more than 20 more Gaza hospitals as well and medical facilities. Why do you think they did this?
Sure. It's shocking, but it basically is part of the arsenal in the genocide, right? So, I mean, the ICJ has ruled that there's been a plausible cause for genocide in Gaza, and the South African case that took Israel to the ICJ, a large part of the case, in fact, a significant part of the case, rested on the destruction of the healthcare system as part of Israel's weaponization of healthcare to cause a genocide of the Palestinian people. So by doing this, they've weaponized healthcare in two ways, directly and indirectly. And directly, they've done this through bombing hospitals, through targeting healthcare workers, detaining healthcare workers, injuring healthcare workers. I mean, we have they've killed about 1,000 healthcare workers by now. They've injured about 800. They have detained another 800, and within detention, reports have shown that people in detention go through terrible psychological, physiological, and sexual violence. And it doesn't matter who the detainees are, be they healthcare workers, be they children. There have been reports of that. So essentially, they are bombing a nation and then depriving the nation of healthcare to be able to heal, to be able to fix issues, to be able to prevent premature death and morbidity or disease. So that seems to be the strategy here, and that's the direct targeting of the healthcare system. And then indirectly, another weapon in a genocide is to make a place unlivable. And so what they've done is they've targeted what healthcare workers call the social determinants of health, right? So we can't be healthy if we are living in areas where we don't have access to clean water, sanitation, electricity, food, those sorts of things. So that entire environment is not conducive to good health. In fact, it's just a cesspool for ill health. And that is exactly what they've done by bombing water wells, by preventing aid from entering into Gaza, and those sorts of things. So they've targeted the healthcare system in its entirety, basically, to ensure that Gaza, and now the West Bank as well, becomes unlivable.
Thing. But I want to emphasize, rights of Palestinians in particular, and we're talking about it in terms of the UN and United Nations. Now, we know that the right to healthcare is actually protected under international law, and then the failure to be able to provide that, deems it to be, war crimes in that sense, and definitely a crime against humanity as well. What will be the long-term effects of Israel's actions for the people of Gaza?
Sure, it's going to have significant long-term impacts on various levels, right? I mean, according to the UN report, and I'm going to quote, right? They say the hostilities have had a detrimental psychological impact on every sphere of the Palestinian people. I mean, and we can break it down into different sectors of the Palestinian people. So, for example, pregnant women, lactating women, they do not have access to healthcare. the rate of miscarriages has increased by 300% since the 7th of October in 2023. There are several of them. There's been a surge in preterm births, so women giving birth prematurely, and it has poor health outcomes for the baby and for the mother if it's not done under proper sanitary conditions. So, we're looking at that. Then we are looking at the issues around the stress and trauma that these mothers are facing. There are people who cannot access healthcare at the moment, and because of the high burden of trauma and injury, the hospitals have to prioritize that. So we now have a whole host of patients who have chronic conditions, who have cancer, who cannot seek healthcare, and these people are dying prematurely, or they are suffering significantly unnecessarily because, again, they cannot access healthcare. So, and the people who are severely injured, severely disabled, who could be treated and whose disabilities could either be completely negated or at least reduced to a point where the quality of life can be sufficient for a good life. But that's not happening. So the long-term impact is that we're going to end up having a nation or a whole generation of people that is ill, disabled, injured, and all of this will basically have also an impact on employability. So you're now going to have a whole generation of people that, because of ill health, may be subjected to issues around unemployment. And we know that people who are unemployed and who live in low socioeconomic status conditions generally suffer poorer health outcomes and are more prone to suffering from disease and the ill effects of it. And then what happens then is you're going to end up having generations who are living in poverty and unable to get out of that poverty cycle. So it really is quite important that there is a ceasefire, that this stops, and that the world helps to rebuild Gaza, because otherwise we're going to be left with a generation that is just going to be struggling in terms of physical health, not to mention the mental health toll that this entire situation is taking. We're talking multi-generational trauma. Every child in Gaza at the moment is going to suffer from PTSD. Every child and every adult. And the impact that that's going to have on their quality of life going forward is significant, and it doesn't look good.
Yeah, doctor, and I think, also just looking at that in particular and what we just spoke about now, what you're speaking about, the fact that there is also an immense suffering among all these child patients who are being refused to actually leave the country and being allowed to leave at all. We know that that is going to impact them, like you mentioned, in terms of their health. But I think we also have to look at it even in terms of just the existence of Palestinian people. I mean, clearly it's going to affect a lot of people on such a level where, death seems like the only option, right? Unfortunately.
Yeah. So it's those, I can't even believe that I have to say this, right? So those who die will basically escape the horror that is their current living circumstances and their current healthcare system, right? It's a case where people are being targeted, healthcare workers are being targeted, children are being targeted, women are being targeted, ambulances, aid care workers, journalists. Every single protected sphere of human beings, according to the United Nations, is being targeted. And what worries me here is that the precedent that this sets for future wars. In fact, it already has set a precedent. A couple of months ago, Russia bombed a pediatric hospital in the Ukraine. Nobody has any business bombing a pediatric hospital. So aside from the long-term impact on Gazans and Palestinians, the impact and the effects of this war is going to be felt far and wide. I mean, we're already seeing it being spread into other areas of the Middle East. And in Lebanon at the moment also, again, the healthcare sector is being attacked. They're using the same modus operandi.
It's crazy and it's really horrible. I was also just thinking about this inquiry in particular. The inquiry also found that the Israeli army was actually responsible for the killing of that 6-year-old by the name of Hind Rajab. And, also she was shot about 355 times. And she actually, when she called the Red Cross to help save her. Now, this is yet another example of how the Israeli army has attacked the healthcare workers, like you just mentioned, because the paramedics who went out to help her were also killed in that sense as well. What's your opinions and thoughts on something like that?
Phew, I remember very clearly the Hind Rajab case, and having read about it I think it happened in January this year. It's such a horrible example of what's happening everywhere else in Gaza, because it's one example of how children are attacked. Shooting a child 355 times, that's a target. That's deliberate. That is not unintentional collateral damage that is acceptable in any kind of warfare. The ambulance that was on the way to go and save her, there were 2 paramedics in that ambulance. They had coordinated with the Israeli military force beforehand the route that they were going to take in order to get to her. So they knew full and well paramedics were on their way. There was a 6-year-old child in the car looking for help. And what happened? They bombed the ambulance, knowing full and well that it was supposed to have been a protected route. So again, deliberate targeting of healthcare workers and destroying a health infrastructure in the process. That was not an accident. And there are so many other examples, stories on the ground, stories from journalists that I have heard where they have found bodies of children with bullets to their head or their chest. That's targeting. And for so many children, you cannot tell me that is just, by the way, collateral damage because they were looking at a bigger target. So the story of Hind Rajab is an absolutely heartbreaking one, but it has happened everywhere else across Gaza. I mean, we know that children have been targeted, that more than 42,000 people have been killed now, the majority of which have been women and children, right? We know that. We know that a lot of them have actually been targeted. So in warfare, this is not acceptable. And that's why it's one of the reasons why they're calling it a war crime. There's a special situation now happening in Palestine, right? And a new acronym has emerged. And this is also going to impact future generations of Palestine. It goes back to what we're talking about in terms of the long-term impact of Palestine. And so doctors call children who come in that are unaccompanied and they don't know who they are and there's no surviving family. So there's a new acronym and they call it WCNSF, Wounded Child, No Surviving Family. Now, I want you to imagine this. A 4-year-old child, right? And I'm literally quoting from a news article here. A 4-year-old child is admitted to a hospital with injuries, is disabled, is in pain, cannot be operated on without anesthetic. So needs to be operated on an amputated leg without anesthetic. This is the situation on the ground. There's no surviving parents, grandparents, aunties, uncles, cousins, siblings. Nothing. So you have an injured 4-year-old child that has no one to look after them, no one to comfort them, and there are thousands. The UN has not been able to, or the Ministry of Health in Gaza has not been able to fully record the absolute number of these children. But the number of unaccompanied children so far that they've been able to calculate is 17,000. So, and that number is highly likely to be an underreport of the true extent of this. So we're looking at a future generation of Gazan children or Palestinian children without any family, histories and families completely wiped out. And we don't know where or how they're going to end up, who's going to take care of them. Are they going to end up living in other countries, being adopted by other people? Are they going to go from one foster home to another? And I mean, all of this does not provide for a stable, loving environment that every child needs and deserves and has the right to.
No, I completely agree with you. It's really ridiculous that something like that can actually happen, in the country as well. And the thing is, I just wanted to also just say that, looking at South Africa in particular and the fight that we have towards, obviously against Israel in terms of what they're doing, we are seeing a lot of individuals, especially if you're looking at last year in April. I know that there was a conversation that was had around. Pharmaceutical companies in particular boycotting, Israeli products in particular, in South Africa. I just wanted to know before we do, let you go, how far are we with that process and how are we actually looking in terms of that?
So, Healthcare Workers for Palestine collaborated with the BDS movement, which is Boycott, Divestment and Sanctions movement, to launch a campaign against a pharmaceutical company called Teva. And Teva is one of, I think, the largest producers of genetic medicines in the world. So it's quite a big target. And we call them a pressure target because we're basically asking consumers to look for alternatives when it comes to genetic medicines. And there are lots of other alternatives. The call for the boycott itself in South Africa has actually been quite well received by many communities, but we are hoping that more businesses and industries will actually start implementing this boycott in their communities, in their places of work. And I know of a lot of general practitioners, medical doctors, all types of healthcare workers actually that are proudly donning posters saying that their practices are apartheid-free zones. And one of the things that they are doing is actually calling for the boycott of Teva products.
No, I love that. And I think that's such a good, step in the right direction without a doubt. Look, I wish we had more time to chat to you because there's so much to unpack when it comes to this topic. But, we hope and pray that things do change for the good over the next few days and weeks and months in that sense. But, Doctor, thank you so much for joining us tonight on INX Prime Live.
You're most welcome, and thank you so much for having me and for giving Healthcare Workers of Palestine the platform to talk about.
No, you're most welcome, guys. That is Dr. Firoza Amien, who is actually part of the Healthcare Workers for Palestine, which is a South African NGO, trying to do their best to be able to create a better future for the Palestinian people, without a doubt, and also making sure that South Africa stand behind, their pro-Palestinian campaign. Now, on that note, we are going to take a quick ad break. We'll come right back.